This little pill right there, seriously, could save your life. So why the heck aren't you taking it? Hey everyone, it's the Wellness Doctor, Dr. Jeffrey Clark, and this little pill right here is 5,000 IUs of vitamin D3, also measured in a metric system as 125 micrograms. So we are learning more and more about the value of being sufficient in vitamin D3, cholecalciferol. Now, in our bloodstream, we measure that as 25 hydroxycholecalciferol. That's the measurement. And when you have a blood test done, it's measured in nanograms per milliliter. Now, why is this important? Why should you know about it? Well, we have a pandemic going on, in case you haven't heard, called Covid-19, spreading all around the world, and is a huge concern that people don't want to get it, and people certainly don't want to die from it. And my heart goes out to anyone who has died from this. But we have talked in the past about the comorbidities, and we're learning that a majority, if not nearly all, of the deaths in COVID-19 have comorbidities. They have heart disease, they have diabetes, they have obesity. We're learning that obesity is a key factor because with obesity comes all these other disease factors. But we're also seeing an insufficiency in blood levels of vitamin D3. So studies have been done retrospectively as these people have gotten very, very sick or have passed away, and they're looking at the blood levels, how many nanograms per milliliter of vitamin D3, 25 hydroxycholecalciferol are in the bloodstreams of these people. And what they're finding is that a majority are insufficient. Well over 90%, nearly 100% of all fatalities when they have measured the vitamin D levels were very, very insufficient. Now, medical literature suggests that a number over 30 nanograms per milliliter is sufficient. That's absolutely incorrect. That's old data from, I don't know, the 60s, 70s, 80s, who knows? But since 2008, we have known that vitamin D3, cholecalciferol, controls and causes the entire immune system to coordinate itself and function within the body. So if you want your immune system to function properly and be controlled and coordinated in a coherent fashion so that it can do its job, you must be sufficient in vitamin D3. We recommend a minimum of 50 nanograms per milliliter up to 80. And the way to have that titrated is to actually test it. Now, I take 5,000 IUs every day. I've been tested. Now, back in 2008, when I first learned of this research coming out, I had my blood tested, and guess what? I was at 17. I was in that high risk factor. And so I started supplementing. And a few years ago, the last time I had a blood test, I was at 65. That's kind of the sweet spot. And that's about where I want to be, 65 to 80, somewhere in there. It also lowers risk of cancer. People who are deficient, not only do you get more colds, more flus, but you're going to be more susceptible to the horrors of COVID-19 if you were to contract it. Now, we know right now from data, more people are being tested, more people are testing positive, but more people are testing positive and are completely asymptomatic and are probably going to have no problems themselves. The concern is, are you going to pass it to somebody else? Well, we're seeing all kinds of talk on the mainstream media. Who's going to come out with a vaccine? Is it going to be 2 years? Is it going to be 2 weeks? We're not sure when the vaccine's coming out. Well, personally, I'm not going to take the vaccine because I have no faith that something chemically made by humans is going to be better than Mother Nature. But yes, this is made by humans, but this represents something that comes in nature that we are, it's a basic requirement for human health and wellness that we have this sufficiency. If you can just run around in the equatorial regions naked between 10 a.m. and 4 p.m., yeah, maybe you're going to absorb enough vitamin D through your skin from the sun. But for most of us, we don't have that option. You know, I'm north of Seattle. We have something called clouds and rain up here. So I'm not getting a lot of sunshine, and you probably aren't either. So for goodness sakes, supplement that little tiny pill. It costs pennies a day. We have it at the clinic. And what's crazy is I've been preaching this for 12 years. We buy this by the case and it sits there. I think I take more of this home than any of our patients. So please come in, get your vitamin D3, take it every day, get your blood levels sufficient. And if you have loved ones who are at risk, pretty much anyone over the age of 20 is at risk of contracting it, but over the age of 50, they say that's the high risk group. But that's where you have the high risk of heart disease and cancer and diabetes and strokes and Alzheimer's and all the other lifestyle diseases that we develop because we don't live a lifestyle that is congruent with our innate programming. So there you have it. Take your vitamin D3. Please get sufficient. It's simple, it's easy, and it's necessary. It's a basic human requirement for health and wellness. So if you're not, after watching this video, if you don't start taking vitamin D3 and you have some catastrophic health event, that's on you, not on us. So until next time, have a happy and healthy day and make your life healthy. Take care.